Aloha, everyone, and thank you for joining us. My name is Jamie Alden, and this is Susan, and we're West Point graduates and Army veterans. In 2017, I retired from the Army as a Special Forces Lieutenant Colonel after 20 years of service. In addition to our Army service, Susan and I have been involved in the health and wellness industry for almost 2 decades. And we see every one of you as a leader, someone who cares about the people around you. So thank you for taking a moment to hear this information. We have a very special teammate, fellow veteran, and leader with us today. But before we begin, we want to recognize the other medical professionals who are listening today. Susan and I want to personally thank all of you for your tireless hours, dedication, the courage, and most importantly, the love you have demonstrated to our communities during this pandemic that is affecting the entire world. You are truly inspirational, and we can't thank you enough for what you do to keep us all healthy every single day. Susan and I are also grateful for the incredible team that has joined us in this movement to improve health at the cellular level. We may be in Hawaii, but this is a global movement. Our team is filled with leaders from across the continental US, in London, growing in New Zealand, Australia, and Asia. Thank you for saying yes to this opportunity.
Jamie and I are extremely passionate about the information that Dr. Goodman is going to share with you today. Our personal experience with these products has truly been unlike anything we've experienced before. But what has really solidified our belief is the remarkable impact we've seen with these products in terms of our friends, our clients, and our family members. This past fall, my dad received a devastating diagnosis, which is what really drove me to dive deeper into the research about Nrf2 activation and disease. I'm happy to say that Dad has been able to successfully integrate these products into his conventional medical treatment that he's receiving through the Duke Cancer Center. And thankfully, he's now on the path back to good health. Jamie and I could share endless testimonies about how these products have been a game changer for us, for those that are struggling with chronic health conditions, kids, members of our military communities, as well as high-performance athletes. But for now, it's my great honor to introduce to you an incredible servant leader who is helping to bridge the gap between herbal medicine and conventional Western medicine. Dr. Goodman is a 14-year veteran of the Army Medical Corps, and he continues to serve as a pediatrician in his community. He's been practicing pediatrics for over 35 years, and his wife, Peggy, is also a doctor. She's also a veteran of the Army Medical Corps. She's an OBGYN, and it is my absolute pleasure to introduce him to you all. I want to make a quick reminder that if you have questions that come up as he's presenting, to please type your questions in the chat and we will address those at the end of the presentation. So Dr. Goodman, thank you so much. Welcome once again, and we look forward to hearing from you.
All right, well, thank you so much. I appreciate the opportunity to talk to this group. You guys are dear and near to my heart, being ex-military, and I really enjoyed my tour of duty in the United States Army. I got out in, I think it was 94, got in 1981, I believe. No, I think it was 78, believe it or not. I trained at Fitzsimmons Army Medical Center, where I was there, as well as Fort Benning and Fort Gordon, Georgia. But prior to that, I received my medical degree at the Medical College of Ohio at Toledo and my bachelor's degree in microbiology and immunology at The Ohio State University, which is where I started my ROTC career. I'm going to switch to my bio screen real quick and try to do a share. Let me see if this works for you guys. Let me know if you got it, if you can give me a thumbs up if you see a share. You got it? Okay, good. Thank you so much. Anyways, thank you. I'm a fellow of the American Academy of Pediatrics. I'm still practicing. I've been practicing pediatrics for over 30 years. I'm a member of the American Academy of Anti-Aging and Medicine, as well as a member of the Institute of Functional Medicine. And I wanted to get more knowledge about what I was doing with regard to Lifevantage products, as I was seeing some really impressive things myself, and also with my use of these products with my patients. And that's something that we'll talk about we have to be careful as we talk about things that are, say, not necessarily what Lifevantage products are marketed for. You have to understand that we have to be cautious in this current era because we are talking about nutraceuticals. And so in that light, I want to try to be compliant. But I want to thank you for being part of this presentation. I'm going to change to my next screen here. I'm just going to sort of just go with the flow. I sort of gave a preemptive sort of warning. I don't want to say a warning really, but I have a tendency to go in depth, okay? If what you're looking for is a lot of scientific knowledge, you're going to get it tonight. And I try to make it digestible. I'm not trying to, overwhelm anybody, but I think that if I can give you the nuts and bolts of it so that you really understand it and the light bulb goes on and you really see what we're talking about here, I think you'll be as excited as I am. And I'm excited all the time. The title of my presentation is Biohacking with Nutrigenomics, a systems approach to nutrigenomics, wellness, and aging. And I like to tell my clients and people who see this that this may be the single most important health presentation of your life. I mean it. I call it the Biohacker's Guide to Wellness and Aging. And I do make the FDA disclaimer that I do not make claims to treat, cure, diagnose, or mitigate disease. This is purely informational. Now, as you may or may not be aware, there are 3 genetic signaling pathways of activation that involve various theories of aging. If you haven't heard of them before, you're going to learn something new, and it's going to blow your mind. First is the Nrf2 pathway, which is involved in the oxidative stress theory of aging. Next is the Nrf1 pathway, which is involved in the mitochondrial theory of aging. And finally, there is the NAD signaling pathway, which is involved in the sirtuin theory of aging. This presentation is really just going to focus on the Nrf2 pathway and the oxidative stress theory of aging. It's complicated enough, and if we decide later that we want to cover some of the other ones, I'm happy to do that, perhaps at another time. But I think for the nuts and bolts, we're going to focus on this. So this is a representation of the oxygen molecule. We have mostly learned that this is necessary for life, but it's not as good as you might think. It has a darker side. Remember that the air that we breathe is actually only 21% oxygen and 78% nitrogen. And to pediatricians like me and adult pulmonologists, we recognize that too much oxygen is actually toxic to the body and can actually damage the lungs and damage the eyes. This is especially true in premature babies. In actuality, our continued daily need for oxygen is part of the reason that our bodies suffer slow, progressive damage that we may not even recognize at first. The reason for this damage comes in the form of radicals. No, not this kind. This kind, free radicals, millions of them. Free radicals are supercharged oxygen particles that bombard the innards of the cell like shrapnel. They're able to poke small microscopic holes in our cellular material. They're a product of metabolism and occur in response to our environmental exposures to toxins, smoking, UV light, radiation, pollution, and many other sources, including the one that we're facing right now. Its main mechanism of action is oxidative stress. I'll just say that. The common denominator of these free radicals is the oxygen molecule. We'll just call them free radicals, these free radicals I'm talking about, the bad guys, just to keep it simple. But the common denominator is, in fact, oxygen. So oxygen causes oxidation. You know its effect on metal. Steel rusts, aluminum corrodes, but our bodies are essentially rusting too. But it's occurring on a very slow, cumulative way. It manifests itself first as maybe skin wrinkles, then cell damage, later inflammation and dysfunction. It culminates in what we refer to as aging, disease, and ultimately death to our bodies. Now, an analogy is this apple that sits on the counter for a half an hour after taking a bite out of it. It begins to turn brown, and it turns brown because of the effect of oxygen-derived free radicals attacking the flesh of the apple. You're seeing it in real time, but this is also happening to our bodies, slowly and quietly. I want to ask my viewers, And those that can raise their hand or indicate in the chat, who here is taking an antioxidant like vitamin C, vitamin D, or eating healthy greens like broccoli or kale? Raise your hands. Okay, I see a lot of hands. That's great. Well, congratulations. You are all biohackers. Whether you know it or not, you're taking them to counteract the effect of free radicals. You see, the opposite of a free radical is an antioxidant particle. These donate an electron to the free radicals that want to steal it from our cells and essentially neutralizes it and turns it into water. This is the constant battle that is in all of us. So those external foods and supplements are called secondary antioxidants. It's what doctors and health advocates have been suggesting to help us with this battle. They're at the bottom of the pyramid. They're typically vitamins and minerals, but they're weak in comparison to what are on top. The ones that our bodies were born with and that we can make are called primary antioxidants. And these antioxidants are many times much more powerful. They go by complicated names like SOD or superoxide dismutase, catalase, and glutathione peroxidase. It's not important to remember these names, just know that they exist. I like to put a Superman symbol by them because they are the good guys. When we are young, these internal antioxidants were plentiful and could easily deal with the constant onslaught of free radicals that occurs in our bodies. But around age 20, because of the cumulative damage that has already begun to occur to our cells, our ability to make them starts to decline. When the amount of free radicals produced exceeds our capability to neutralize them, that's what we refer to as oxidative stress. It's as simple as that. It's an imbalance. Oxidative stress is a contributor to the aging process and over 200 to 500 different health problems. If you go to pubmed.gov, the NIH literature research website, and type in oxidative stress and almost any health condition that you want, you're going to discover a link between them both in most cases. So oxidative stress can affect all of these different organ systems. My job as a physician has been to treat these different organ systems with drugs or pharmaceuticals in order to reverse various conditions and to improve people's health. But maybe in fact what we should be doing is to reduce the central cause of all of these, free radical damage and oxidative stress. We do that by bringing in Superman to reduce oxidative stress and increase our own cellular production of those three internal antioxidants that I mentioned, SOD, catalase, and glutathione. Now, you can take glutathione as an IV, but it's inconvenient and it's expensive. And oral forms typically are not very stable. The others are not stable, nor are they available to take as a drug. So now it's important to note that our survival genes have been mapped on our 46 chromosomes. If you look closely at this diagram, you can see 23 pairs of chromosomes. The horizontal lines that are going across are actually genes. And these genes code for proteins and enzymes. And in particular, the Nrf2 protein, the Nrf1 protein, and the sirtuin proteins have been identified as master regulators of cell protection. So we have 23 pairs of chromosomes, right? But our DNA is not our destiny. That is, we do not have to suffer the lot that has been dealt to us in our genes. Only 20% of our DNA is expressed at any given time. 80% actually lies dormant. It's just waiting for a wake-up call or a signal to turn it back on. This is the exciting science of epigenetics. You can purposely change the way that some of your genes are expressed. And when you do that, that's what we refer to as biohacking. You are using science to turn on your body's systems for something that it already knows what to do. The other option, of course, is just let your body be hijacked. We're hijacked every single day, physically, emotionally through stressors, biochemically through toxins, radiation, allergens, pollution, poor food choices, alcohol, drugs, on and on. But when we biohack, we are optimizing our genetic potential to become the best versions of ourselves. And we're using the science of nutrigenomics. So nutrigenomics, it's a new word. This is where food influences how our genes behave and how they're expressed. Remember, food is code or a signal for our bodies. It's more than just calories and nutrition, as you've probably known it. Now, we know that we can activate the Nrf2 protein using cell signaling, which subsequently increases SOD by a remarkable 34%. We can increase catalase by 54% and increase glutathione by 300% in only 120 days. The net result is that we can actually reduce oxidative stress from free radical damage by 40% in 30 days in essentially every single person who's ever tried to do this. And we do this by signaling specific proteins and genes using organic plant-based nutritional products. And these studies were performed and are published at PubMed.gov in over 26 peer-reviewed literature articles that were from such prestigious organizations as the Ohio State University, which was my alma mater, Louisiana State University, University of Colorado Health Sciences, which I had the occasion to visit while I was at Fitzsimmons, Vanderbilt, Harvard University, and many more. They were independently researched by these organizations without any association with Lifevantage. They've been documented, scientifically proven over and over. There are actually 6 international patents and 7 US patents for the Lifevantage company because of this research. This is really incredible, you guys. So you know this problem all too well. French fries are $1, right? But try to eat something healthy and it's $6. So people are fed by the food industry, which pays no attention to health. And they're treated by the health industry, which pays no attention to food. Well, Lifevantage seeks to change that paradigm through cellular activation using Nrf2 synergizer, which is found alone or in combination with other activators in the Vitality Stack or the Ultimate Stack. So let's talk about Protandim Nrf2. It's one of the 3 nutrigenomic activators made by Lifevantage. It's derived from plant sources to signal the Nrf2 pathway in our genes to turn on the production of our primary antioxidants at levels that can't be reached by merely eating antioxidants from plants or pharmaceutically. The patented ingredients and proportions include ashwagandha root, bacopa extract, green tea extract, milk thistle extract, and turmeric extract. Remember, these are extracts and organics that have been used through the centuries in both Chinese and Indian medicine, but they didn't really understand what it was doing or how it worked. And although each of the ingredients may in fact be an antioxidant in their own right, that's not how we're using them here. We're not using them as antioxidants. Look at the bar graphs on the left. They're too weak by themselves. The lines are pretty low on the graph. However, in the correct ratios, together, synergistically, they were found to actually amplify each other greater than their individual components to the tune of 1,800%. And they do this by turning on the survival genes, signaling and activating the Nrf2 pathway in all of your body's 37 trillion cells. In essence, telling your genes to make their own antioxidants to the tune of millions. So like normally, one antioxidant particle neutralizes one free radical, and then it's done. That's a 1-to-1 ratio. Protandim is able to neutralize 1 million free radicals per second, a 1-to-1 million ratio. You would have to eat 375 oranges or 11 pounds of blueberries. Good luck with that. How about 87 glasses of red wine? I don't think I'd want to try it, and most of us wouldn't want to either. Or how about 120 vitamin C tablets, which would probably be toxic? But that's just to equal the neutralizing power of just one Protandim Nrf2. I don't know about you, but I want to be on the 1-to-1 million team, not the 1-to-1 team. This graph shows what oxidative stress levels are from age 20 to 80 during our natural life. And this occurs because of the cumulative effect of free radical damage that I spoke about. Now, when Protandim Nrf2 is introduced, oxidative stress is reduced down to the level of a 20-year-old in almost everybody who's ever taken it. The p-value for this, for the scientists here, is 0.001. As I said, This was proven in at least 27 university studies and published at pubmed.gov. That's a 40% reduction in oxidative stress by 30 days and up to 70% reduction by 4 months. This statement was approved by the FDA. Now, this is a diagram that illustrates how different substances compare to Protandim Nrf2. On the lower right corner, we see a graph illustrating the Nrf2 gene induction by sulforaphane, which is the main active principle in broccoli and kale. Now, in the left lower corner is a drug called Tecfidera, or dimethyl fumarate. It costs about $50,000 a year US to take, and it's used as a treatment for multiple sclerosis. It's also an Nrf2 activator. In the upper right-hand corner is a drug called bartoloxone, which did not do very well in clinical trials because it had a lot of side effects. And now, in the top corner is Protandim Nrf2. Look at the levels that are attained compared to the drugs. Simply unbelievable, right? I mean, this is crazy. We've got this in our hands, and look how it compares to a $50,000 drug, and it's just a little over 50 bucks. It's ridiculous. And actually, people with conditions are using this, okay? Now, I like to show this analogy of gene expression as shown by a keyboard. Now, if each of those keys was a gene that was expressed, and each key played a specific note, we could measure those notes or those frequencies. Now, there are over 400 genes that are affected by Protandim Nrf2. We've only been talking about 3 primary antioxidant genes. But there are many, many other genes that are affected. Let's just focus on 63 of the 403 genes. Okay, this next illustration shows that these keys play specific notes and that the note frequency shown above as green bars are in a nice, smooth pattern. Now, in 1969, Grandma bought this brand new piano and it was perfectly in tune. But Grandma put this piano in the attic for 50 years, and now it's not playing so nice. The notes are up and down. This piano sounds terrible. It's out of tune. So it's the same with this graph of 63 genes. You can see that the expression of these genes is up and down all over the place. Some of the genes are expressing too low, and some of the genes are expressing themselves as too high. This is a human whose genes are out of tune like the piano. Now, after Protandim was introduced, look at what happens to the gene frequency. The genes that were too high are now lowered, and the ones that were too low are now raised. This genetic gene expression frequency curve has been tuned in the face of Protandim. This is unbelievable. But look at this. If you zone out on that little box, which was the 63 we talked about, this is the bigger picture of the 400 plus genes that are affected by Protandim Nrf2 and the gene frequency response under it. It shows a nice smooth curve. It's not discordant anymore. We were previously only looking at a cone down view of 63 of them just to make the point. Now, in 2015, in response to the research, Washington State University said that we may be on the verge of new literature on the health effects of Nrf2, which may very well become the most extraordinary therapeutic and preventative breakthrough in the history of medicine. Wow, right? Do you see why I'm so excited to share this? I mean, it's absolutely mind-blowing. There is currently no other product in the world backed by peer-reviewed scientific proof that does this. So we want to reduce our oxidative stress by 40%. We don't want to take antioxidants. We want to make them ourselves. We want to fight free radicals 1 million to 1 in every one of our 37 trillion cells every second of every day. We want to increase our SOD by 34%. We want to increase our catalase by 54% and increase our glutathione by 300% within 120 days. We can now activate over 400 other survival genes besides the 3 internal antioxidants that I spoke about. And we help our body to detoxify and remove the trash buildup from our years of living back down to the levels of a 20-year-old or lower. Now, by the way, as many of you already know this, Protandim Nrf2 also exists for our pets as pet tandem. since their oxidative stress levels are 7 times ours, and they age faster. Protandim has been shown to extend lifespan by 7% in some mammals, as reported by the National Institutes of Aging, which is a division of NIH. So realize, folks, that now you have the power to biohack your own body. This is not a bad thing, this is a good thing. You can use science to improve your body's innate ability to heal and repair itself. You're optimizing your potential using nutritional science or nutrigenomics. When we signal these genetic pathways in our genetic code, it's essentially like flipping a switch. We do that so that we can feel better and so that we can do more. And I thank you all for your attention. I'm going to unshare my screen if I can figure out how to quit it. I hope you guys got some good information out of this. I got to expand my view so I can figure out how to unshare. And I apologize for not being too good with this Zoom thing.
End share. It's a little red button at the bottom of your screen.
I'm looking for it. Okay, I found it. It's on my other screen. Thank you so much, Jamie. I appreciate that. Let's see if we stop. Okay, there we go. All right. So, Jamie, I just, like I said, I wanted to go in depth for your audience to let them really understand how incredible this science is, that we have it. And we're so fortunate to be able to spread the information, to share it with those that we love and care about. And I want to, do you mind if I just speak freely for a moment?
Please do, absolutely.
Yes.
You know, people ask, why did I get involved with Lifevantage company? I mean, I'm a successful pediatrician. I've been practicing many years. I was not wanting to market anything per se. That wasn't my goal. My goal was to help people. I saw people in my practice that were suffering on so many different levels, not just the kids, but the parents. There was so much work to be done. And I had so much influence in speaking with my families that I was helping their children using nutritional manipulations, if you will, to help with various things that they came in with, as opposed to trying to use medicines all the time. I was actually trying to put this into use. And I had such dramatic benefits for the kids. And then the parents realized that, oh my God, I need to be doing this too. And as I explained the science to them, the thing just sort of snowballed. And so I've been incorporating this into my practice of medicine. And while it's not traditional, because I'm trained to use medicines, and that's what, you know, Western medicine's about, I've branched out beyond that. And I found that my outreach and my ability to help people was so much greater if I would do that, because now actually I could have some influence on the parents and their grandparents and other family members who, when they got turned on to this, were also having incredible benefits.
No, that's great. Thank you, Dr. Goodman. I mean, what a powerful message, and what a very powerful presentation. That graph of the four charts together, and the comparison of the drugs and what we have in our product in the Protandim Nrf2 is just an amazing slide. So that was very good. Thank you so much for sharing with us today and taking the time. And you know, just for everyone that's on the call, you know, we're a team of professional leaders. So just please circle back to the friend who invited you to this call and let them know how you want to get involved. If you're interested in taking the product, joining our team of leaders that's growing globally, or both. So, you know, Susan and I are involved in this company because we believe in the product, and we have confidence in the leadership of our publicly traded company. We know that it is our family's opportunity to continue to serve. And it's our chance to help change the lives of the people around us. And
that's exactly what you're doing, Dr.
Yeah.
Goodman. We met Dr. Goodman at a Lifevantage convention, or I did, and your story so moved me about not only why you became a pediatrician, but why you're integrating this into your practice. And we have a couple of questions here, and feel free to continue to type your questions. I want to kind of address them as they came in. Let's see. Yeah, sorry, there's a lot of questions on here. So several people are asking about different studies, and could you direct us to any studies that focus on outcomes? So we know we can't talk specific health conditions here, but could you explain PubMed just for a moment and how to find specific studies related to the health conditions people might be concerned about?
Right. Well, I would encourage anybody to go to, as I said, pubmed.gov. There's a search engine there that you can type in whatever thing that you're interested in and type in, oxidative stress, or if you want to type in Protandim Nrf2, you can search for the research directly as to what was published about that. There are a number of studies that were done both in animal studies, in vitro studies, and also human studies about this particular product. Now, again, in the interest of compliance with the FDA, because these are nutraceuticals and in the supplement class are technically classified as a food, we can never state an association with a disease. It's just the way that the government works. And I have to respect that, because in doing so, I would compromise the work that all of us have been doing in the Lifevantage company to try to further health and benefits. But if you connect the dots and realize that this is working at the cellular level to reduce one of the main constituents of something that causes our bodies to suffer and age at many different levels. And as I said, a lot of these genes control very, very vital functions. And you can research this. And it's beyond the scope of this presentation to talk about them individually, but you can research those genes. They're listed as to what are the effects that they have on those particular genetic expressions. And then if you follow then what those genes control, you'll get to understand, in fact, how that might benefit. Now, everybody's experience with Protandim is different. My experience was different. I can tell you things that I actually experienced. I mean, I wasn't really expecting it. Again, I wouldn't ever share anything with a patient that I wouldn't be willing to take myself. And I've been on the products for over 3 years myself, as has been my family. But I can relate maybe some stories in general. I can speak in generalities. But I will tell you that I was taking a number of different medications for my own personal health. And after being on the products for about 6 months, I was able to have those medicines and use less. And that is not an uncommon situation for people, because there's a certain amount of healing or reversal that takes place when you're on this, because that's really what we're talking about, reducing the effects of oxidative stress, which manifests itself in many, many different illness categories, okay? Again, you see I'm speaking in generalities. Again, if we were on a one-to-one in a closed session where I could speak in confidence to a small group, I could speak a little more freely, but we're on a broadcast medium and I can't do that. But different people have different experiences. Most will say that they have just increased energy, increased resilience, improved exercise tolerance. They don't tire as easily. They sleep better. They note that their skin condition improves, that they seem to show less signs of aging overall. Typically, our experiences is that depending on what your age is, for every decade of life that you are in age, it takes approximately 1 month in order to knock that down to a level that is more tolerable. So in other words, I'm 60 years old, and it took me about 6 months to find the benefits to me. I took sort of an inventory of how I was feeling prior to starting the product, because I was curious. I was monitoring some laboratory studies to see what my different markers were, such as CRP. You can get oxidative stress markers. They're a little bit expensive, but you can get them. You can measure self pre and post treatment just to see what your curiosity is. You may find changes in your markers for your cholesterol and other factors. In particular, if you're being followed for any one of many different specific problems, follow those markers and watch those markers go down, and you may find that you reach a new level. So that's my advice on that.
Thank you. Okay, we've got a couple of questions that are sort of related to drug interactions. Have you seen any, or do you have any concerns about these products interacting with pharmaceuticals?
Okay, so, and that's a good question. All right, so again, if you recall that graph that I showed you of how small the quantities are and how little the effect are individually of each of the individual components, it is the fact that they're working together in this amplification scheme that signals this Nrf2 gene. That's really how the effect is taking place. This is a signaling mechanism. We're not taking huge doses of turmeric or ashwagandha. There are lots of concerns about some of those individually. They're very small amounts, actually almost negligible, to be honest. However, the signaling effect on the Nrf2 gene is clear. That is really what we're after here. We're using it in a different fashion. Again, if you were to take turmeric, say, for example, for turmeric's sake, you might be taking a couple teaspoons or a tablespoon a day, or mixing it into your diet, or ashwagandha. And at those levels, you might see indeed some toxicity or interaction with other things that you're taking. But we're talking about really, really small portions. So as a food, because it's classified as a food, you need to take it in that light. It is essentially at a food level. So I would say to you is I have absolutely no fear of any interaction of any of the ingredients, unless, of course, one was particularly allergic to, say, an active component of the Protandim tablet.
Great, thank you. Somebody also asked, should we take it at a certain type of day or time away from taking certain pharmaceuticals?
Okay, so in general, it doesn't matter what time of day that you take it, okay? You can take it any time of day. It seems to go down better if you take it with something that includes a little bit of fat in your diet. So if you had it with breakfast, for example, that just helps it to be absorbed more efficiently. Now, we have some elite athletes that are ultra marathoners and have extremely high oxidative stress. Triathletes, Iron women, Iron men, who take these products and use them at much higher levels than even I use it. Some of them will take 2 or 3 in a day. Okay, but they're also biking 100 miles a day. So they have huge amounts of oxidative stress. They don't seem to suffer from taking multiple doses of it. But in general, we recommend that you take it with food. That just makes common sense. If one were to take a number of different pills, perhaps it might not go down easy if you have a whole fistful of pills to take, in which case then you might want to separate it by a couple of hours. But as far as a direct interaction, I can tell you that in some of the products that I currently take that are still pharmaceuticals, I actually take all of them at the same time as my Protandim without any problem.
Great. And kind of along those lines, if you're already taking turmeric, milk thistle, or any of those individuals, should you stop taking them while you're taking Protandim?
That's also a really, really good question. Okay, so this gets into the concept of the synergy of the ingredients. Understand, and I'll give you a little bit of historical background. The SOD, superoxide dismutase, was discovered by a Cressy Award, it's almost like the Nobel Prize winner in chemistry, back in the 30s or 40s, okay? That gentleman who discovered superoxide dismutase as one of the biochemists at the Colorado Health Sciences Center, went on to work for the next 30 years to try to find out what organic, natural products would possibly influence the production of SOD. That was his whole life work. And he looked everywhere. I mean, he tried turmeric, he tried bacopa, all the ingredients that you see. This list was much bigger. And he came down, he said it was literally the proverbial needle in a haystack. He's not even sure how he came about it, but he found that when he used those in a specific ratio, that's what caused the Nrf2 signaling to take place and increase the SOD levels to the extent that you see. So it turned out that if one were to take Protandim and then offset that mixture, that ratio, by taking extra turmeric or extra ashwagandha or something else, you actually negate the amplification scheme that's taking place in that research, and you nullify it. So you could render it potentially just like a plain antioxidant at that point. My recommendation is not to take it at the same time as green tea, turmeric, or any of the active ingredients, to take it by itself and with your pharmaceuticals if you choose, no problem there, but do not take it with any of the other existing ingredients at risk that you will not get the effect that you want.
Right. And what about, we have someone who is a kidney transplant recipient. Do you have concerns about potential interactions with immunosuppressants?
Okay. Actually, I don't think that I can speak to that. I would take my recommendation would be is to talk to your doctor, because he's altering and modifying your immune system, and everybody's regimen is so different. I think anytime you're attempting to biohack like we're doing, right, and you are wanting to know how that lines up with the medicines that you take, you should ask your physician for guidance. Okay, there are he may be opposed to that. I don't know. But I think I would share that. I would never do anything on the backside or secretively without enlisting the help of the physician who's caring for you.
Absolutely. And given you're a pediatrician, would love to know your thoughts. I know some on the labels it says for people over 18, but what's your thoughts on that?
So I'm just going to say that I routinely use it in children. Again, it's considered a food. I consider it a food. It's merely a matter of the proportion or the size. The amount, and can the child swallow a pill? Can you crush it? It may not be palatable. If you crush it, for example, that may make a difference. There are some guidelines as you start to explore this a little bit more as to what to do, but I routinely use it in people even down as young as 3 years old.
Right.
Wow, thank you.
Yeah.
And one of the things I didn't say when I introduced you, but you are also a Lifevantage distributor, and I know you feel passionate about.
Absolutely. Yeah, I've been a distributor for 3 years, and I'm actually on the science advisory board for the Lifevantage company. I was elected to that position last year because I am so outspoken about the science. My whole motivation is to try to take something very, very complicated and make it understandable to the lay person, okay, not to confuse people. I think there's a lot of stuff out there that people will just spew BS all day long, or just try to baffle people with just a lot of big words and try to convince them that they've got something. I'm telling you, again, I did this because I wanted to help the kids that I was taking care of. That was my sole motivation. I wanted then to, after that, when I saw what was happening with the kids that I was caring for, I was so amazed. I was like, I've got to go back to school for this because I didn't even train in this field. I went back to learn about nutritional science, nutrigenomics, functional medicine, so I could apply this in a comprehensive way and understood what was happening, because I did not at the time have an explanation for it. I was mesmerized. I could not freaking believe it. And then when I told, most people are like, you got to be kidding me. And I'm telling you, it was real. And so when I was convinced of that, when I convinced myself of that, when I dug through the research and dug through the patents and went through all the research articles, which, do your due diligence, there is nothing else that I have ever seen that has been researched, published, patented. I mean, this is just not a fly-by-night thing. This has been around now since 2003. And it, didn't get a lot of traction at first because originally when the Lifevantage company promoted it, they sold it in a retail outlet like GNC. And it was sitting there on the shelf because nobody could explain it. I mean, you have, some 18-year-old kid who's working in GNC and you show him a bottle of Protandim and he's going to explain what I just did for you? No way. And so nobody knew what to do with it. And the product really didn't get a start. And they figured the only way it was going to the word was going to get out is it needed to be put into the hands of people who could explain, who could tell a story, who could speak to it, who could use it, word of mouth. And that's how it got into the direct marketing sphere. And that's really the reason why it's here. And honestly, it's done it an incredible service. The Lifevantage company went from a $2 or $3 million company to a almost $300 million company in the last 10 years. And this company has just been going crazy. Not to mention, it went international. It's in, I think, 17 different countries. The number may be wrong, but it's in Europe, it's in Spain, it's in New Zealand, it's in Australia, it's in China, it's in Japan, Korea. I mean, it's all over the place now. And the reason is because it's validated. Okay, this is not a fly-by-night thing. This is the real deal. But not only that, the company is so dedicated to the research and the science that they came out with these other subsequent sister products following the same idea of nutritional activation of genetic expression. And they did this with what I told you, the other pathways of aging, the mitochondrial theory of aging, which is a whole talk by itself, and then the NAD sirtuin theory of aging, or the informational theory of aging. These are all scientific studies. I mean, people have written books about this stuff, okay? But we have taken such a novel approach. And as a representative, I speak as myself, but I also, too, become a representative for the Lifevantage company because of the fact that I am sharing this knowledge with everyone. I want to be accurate about it, but the company has they are very forward thinking, and they are not looking at the problems that we see in just a general way of like, oh, we've got a pill that, oh, it does this. Or if I tell you that it's going to give you more energy, but where's the proof? Where's the proof? These folks are doing the studies. The last patents, in fact, there's 3 more patents coming out soon on the fact that all 3 of these nutraceutical activators can be used simultaneously, and they amplify each other, which is I haven't even spoken about. And that study is going to be published very shortly after the patents are issued, but presently it's in patent pending. This doesn't happen all the time. It's very difficult to get a patent on a nutraceutical.
Ooh, so much information.
Yeah, I sometimes can't even believe that I am associated with this company and what I've been doing for folks. It is my heart to share with you guys. If you have a deeper understanding because of some of the things that I said today, then I've served my goal. That's what I want to do. I'm not here to sell a product. I don't sell products. Okay, I don't look at it that way. I look at it as I'm listening to people who I know have issues, problems. I don't want to, again, I don't speak to conditions at this time. I recognize that. If I think I have a solution for them, I'm going to share the idea with them that there may be something that might help them. Okay, it's their decision whether they want to do that or not. Okay, I think the price is affordable. I think the potential, the upside of this is absolutely unbelievable. I've just seen so many dramatic things in my own life, with the life of the kids that I've touched. I've seen transformations, literally transformations in kids that the parents were literally wanting to give up on them for whatever their condition was. Again, I'm not being specific. And they did not need to take another avenue because, in fact, they were helped so dramatically. And I hear this time and time again. So I don't think this is just panacea, that it's just, BS kind of stuff. I think this is really, really something special. And Lifevantage is the only one who has it. We have something so unique in the marketplace. And that's why all the rumor, all the discussion about it, why everybody's so psyched about it. So it's real, it's palpable.
Oh, yes. I tell you, we've got a couple of questions in here. I'm going to try to bring these together a little bit. One of them is very specific about there's a parent who is taking the product and having great success, and has a child who she feels like it would help this child's condition, but is finding the doctors not being very open-minded. And of course, we see that. I was blessed that my father's doctors at Duke Cancer Center were like, absolutely 100% take it. But we certainly find some doctors open and some doctors not open.
I'm not going to say that problem isn't real. Not everybody can look outside the box. I was trained in medicine. That's my degree, a medical degree. I learned to use medicine to treat conditions. We're talking about the new future of medicine. It's sometimes hard to get somebody outside of their comfort level to look at that. If something is not going to harm someone, and it's safe and it's seen as a food or a nutritional product, then I have had a lot of parents who I'm not necessarily always their doctor, right? But, sometimes I see them in a different circle and they'll ask me questions like that. And I'm not going to step on anybody's work and get in the way of what another physician has to say. But that parent still has the right to make a choice for their child and advocate for their child. And sometimes the physician is clueless. I have talked to physicians who don't get it. They do not get it. Okay. And I'm sorry for that. I mean, I feel like I've failed in that instance, because I'll try to present information to them and show them research. I've got these articles, you've got these articles, and we can steer our people to find these things. But sometimes it's really hard to get people's head out of the sand. This is where things are headed now. Okay. I mean, this is a huge, if you read the books, if anybody's gotten the book written by Dr. David Sinclair, Lifespan, Why We Age and Why We Don't Have to. He's a Harvard geneticist. Get that book. Look at how deep this rabbit hole goes. It is absolutely amazing about how Nrf2 affects neuroplasticity and the ability of the brain to be protected and heal. Okay, this is huge. I'm just talking in generalities here, but do your research, do the reading, open your eyes. It's amazing where this is all going. The effects that diet and other things that we eat and ingest, what negative effects they have on our body. Certain foods, which are quite frankly toxic, okay? That you still have to be healthy. You have to exercise, you have to eat correctly, you have to take the necessary steps to get the toxins out of your diet and open your eyes and not feed, bad food to your family. You got to do that. I mean, that's at the basis of everything, right? And then and that's still part of biohacking, okay? Biohacking is such a big field.
It is. Well, Dr. Goodman, I think this has been so powerful for me, and I think it's been powerful for everybody. I will tell you, I told you personally, but I'll share with this group. When I first met Dr. Goodman in October this past year at a Lifevantage convention, and he gave his presentation, gave a science presentation, and then he shared his story. And by the end of it, I was in tears. And it's funny because I showed up there going, I'm interested in learning more about this, but I wasn't totally sure. I thought, well, I'm gonna stick my toe into this business and just see what it's about. And my heart was just blown wide open by all the presenters, and especially Dr. Goodman. It'll make me cry just thinking about it. But you really helped me see my why, because we both have a heart to serve, and we want to help people across the globe. And it dawned on me that this is the way to do it. Right. So this is more than a business for us. This is an extension of our service, and I know you feel that way. Thank you so much.
Yeah, you guys hear her voice in the background. I got to tell you, my eyes are welling up right now because I feel like this all the time. You know, when you know you're doing something so good for people and people are benefiting, even if they don't know it at the time, and your outreach is so strong that other people can at least look at it and think about using something like this, or, I mean, I'm encouraging you to try it for yourselves, of course, but once you have your own, everybody has their own personal story. Once you have your story, you have your story. I don't know how much time you have here, Susan, but I mean, I can briefly mention it. I don't want to tire everybody because we're going long, but you know, I want to answer people's questions. But I'm just going to say this. I was a smart kid growing up in high school. My dad was never home. He worked late hours all the time. He was a heavy 3.5 pack a day smoker. I lived in a house that was essentially a fumidor. The house was always covered and filled with smoke, so thick that I could scrape the nicotine and tar off of the windows to see. And I had to come home with that. I could not escape that environment. I lived in that environment for the 17 years that I had him as my dad. And then he died. He died of, what do you think, right? Lung cancer. And I went to his chemotherapy treatments. I helped him. I helped my mom to go to those chemotherapy sessions. It was very difficult. And I remember his doctors being what I thought was sort of cold-hearted, not warm individuals. And it was that moment that I wanted to be a doctor. I wanted to be a doctor because I wanted to prove those guys wrong. I did not want to do medicine the way they did medicine and to treat my family that way. I wanted to be a human. And I helped my mother from that point on. And then my mother died 10 years later due to breast cancer, probably as a result of the same toxic exposure that she had from all the years that she lived and breathed that cigarette smoke. And here I am, I'm looking at myself. I've gone to medical school. I know what I know. I've lived in that environment, and I have the same genes as my dad has. And I've absorbed those same toxins, and potentially those epigenetic factors may have triggered or might be triggering some of my genes to express themselves in a negative way. That's called an oncogene. Okay? So you can trigger them positively or you can trigger them negatively. And I wanted to do everything in my power to undo the damage that was done. My parents, neither one of my parents lived past 55 years old. When I got to 55, I didn't know if I was going to be here. I didn't know if I was going to have the same issue that they did, and I was going to have, lo and behold, a spot show up on my chest x-ray. And I was horrified and terrified. And I'm happy to report I'm 60. I'm thankful I'm 60. But this has been my life's mission, to take care of kids, families, to make people less toxic, to help people survive whatever it is, like I said, the cards that they've been dealt. You don't have to accept that. You have the ability to change your own genetic expression. This is not just Lifevantage. This is called epigenetics. It's a science unto itself, okay? Your genes are malleable. You can turn them on and you can turn them off. You might not know what you're doing with it, but when you have somebody who's researched it and has actually figured out which are the switches to turn on that actually help you to encourage good genetic expression so that you can survive your own horror story that you grew up with, my God, I'm going to do everything that I can in that regard, okay? We poison ourselves every single day. We're exposed to UV light, like I said, and pollution and cigarettes and so forth. And, you know, our bodies are responding to that. And you have an option. You have an option to either accept it and just say, oh, that's the way it is. I guess I'm gonna die of lung cancer like my dad. Or you can do something about it. And you do something about it by okay, I'm gonna clean the house out of all the crappy food that I have in there, the diet soda and the non-organic foods that I'm eating, and I'm going to purify my household, and I'm going to make a stand to try to be the best that I can be of myself. I'm going to try to improve my own situation. When, like I said, when you do that, you're biohacking. You're not like sticking an implantable in you or something like that, something weird. You're talking about using food and nutrition and common sense, exercise, and all the things that you've heard about, but you're applying it in a scientific way to try to improve your own status. And that was my goal, and that's the goal that I want to have for my patients. But you don't have to be a doctor to do this. You can do this yourself, and you can do this with your friends, and you can do this with your family members who you know have problems. Help them. You've got an answer now. You've got something that you really, really need to investigate and look at. And that's all this is about, is to look at it as an opportunity to improve yourself. If nothing else, improve yourself. If you see it as something that, because you have a good outcome and you have gotten benefit out of it, that then you want to share it with other people, well, you know what? Guess what? You could make a little living out of it. You might get a little change in your pocket to help pay for your own habit of buying Protandim. Okay, that's really what was my motivation originally. It turned out to be so much more than that. I couldn't believe it. It just was crazy. I didn't expect any of this. And here I am talking to all of you guys. What a privilege.
Thank you, sir. It is just so wonderful to have you.